Hey, this is Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and help patients make informed decisions about their oral health. I only need to see the dentist when something hurts. Today we're talking about a very common dental belief. I only need to see the dentist when something hurts. I understand why people think this. If your car is running, you do not always think about a mechanic. If your furnace is working in January, you're not lying awake thinking, I should probably call the furnace guy just for fun. And if your tooth feels fine, it's easy to think everything must be fine. But the mouth is sneaky. Teeth and gums can have problems for a long time before they hurt. Pain is often not the first warning sign. Pain is sometimes the smoke alarm going off after the kitchen is already full of smoke. That is why dental visits are not just about fixing pain. They're about preventing problems, finding small issues early, and helping you keep your teeth for the long run. One of my favorite sayings that many of our patients have heard me say, the best type of dentistry is preventive dentistry. So keep that in mind as you listen to this episode. Let's start with cavities. A cavity usually begins very small. Bacteria and plaque eat sugar and carbs, then produce acid. That acid weakens the enamel, which is harder outer shell of the tooth. At first, the cavity may not hurt at all. You may not feel a thing. You can chew, you can drink cold water, you can eat popcorn and blame the kernels for all of life's problems. But while you feel fine, the cavity keeps growing. It can move from the enamel into the softer layer under it called the dentin. Then it can move closer to the nerve. Once the nerve starts getting irritated or infected, that is when pain can show up. At that point, the treatment may be more involved. A small filling may turn into a bigger filling. A bigger filling may turn into a crown, a toothache, and may turn into a root canal. And sometimes teeth are not salvageable. It's a big jump. It feels like ignoring a tiny roof leak until your living room is an indoor waterfall. The goal is to catch cavities when they're small. Smaller problems are usually safer, easier, and less expensive to treat. They're also less stressful. Nobody wakes up and says, you know what I want today? A surprise tooth emergency. Dental surprises are not the fun kind of surprises. They're not balloons and cake. They're more like, good news, we found the source of your pain. Bad news is, it's been throwing a party in there for 6 months. Now, let's talk about your gums. Pain is not a great measuring tool. Early gum disease is often don't hurt. The first signs may not be when you brush or floss, puffy gums, bad breath, or tartar buildup. But many people do not feel pain. That is because your gums and bone are the support for your teeth. Think of your teeth like fence posts. The teeth are the posts, but the bone and gums are the ground holding them steady. If the ground around the post slowly washes away, the fence may look okay for a while, then one day the posts are loose. Gum disease can slowly damage the bone around the teeth, but the time teeth feel loose or painful, the problem may already be more advanced. Regular cleanings and exams help spot gum problems early and help you stop them from getting worse. This one is one of the biggest misunderstandings in dentistry. A person may say, my teeth do not hurt, so I must be healthy. But gum disease can be quiet. Cavities can be quiet. Cracks in teeth can be quiet. Infection can be quiet for a while. Your mouth can be polite for a long time and then suddenly be very rude. Dental checkups help because we are looking for things that are hard to see or feel at home. During a dental exam, we check for cavities, cracked teeth, old fillings, things that may be breaking down, gum health, bite issues, signs of grinding, oral cancers, and infections. We look at x-rays when needed because some problems hide between the teeth or under old dental work. Your eyes cannot see between the molars. Even if you have amazing eyesight, you're probably not checking your own back teeth with a headlamp after dinner. X-rays help us to see what is happening in areas we cannot see directly. A cavity between the teeth can grow without being visible from the outside. Bone loss from gum disease can be tracked on x-rays. Infection around the root of a tooth can show up before a person has major pain or swelling. Cleanings are also important because brushing and flossing remove soft plaque. But once plaque hardens into tartar, you cannot brush it off at home. Tartar is like plaque that got a gym membership and became stubborn. It sticks to the teeth, often near the gum line, and can irritate the gums. A hygienist uses special tools to remove it safely. This does not mean you're failing at home. Even good brushers can build up tartar in certain areas. Some people build it faster than others. Some people have crowded teeth, dry mouth, braces, retainers, or other things. They're just harder to clean. Regular cleanings help reset things and give you a fresh start. Now, I want to be fair. Some people avoid the dentist because they're nervous. Some had a bad experience years ago. Some are embarrassed because it's been a long time. Some are worried about the cost. Some feel busy and just keep putting it off. That's you. You're not alone. And I want to hear you to hear this clearly. Our job is not to shame you. Our job is to help you. Dentistry has changed a lot. We can explain things in plain language. We can show you pictures. We can just talk through options. We can take things one step at a time. You do not need to show up with a perfect mouth. If everyone had a perfect mouth, teeth, and perfect gums, we'd all have to find new jobs. I'm not sure I would be good at doing anything else. Maybe professional coffee drinker. But I don't know if that pays very well. At Wahpeton Family Dentistry, we want patients to feel informed, not judged. If it's been 1 year, 5 years, 20 years, the best step is still the next step. You do not have to solve everything in one day. A first visit can simply be about starting and figuring out where to go from there. Let's talk about cost for a minute. A lot of people avoid regular dental care because they want to save money. I understand that. Life gets expensive. Groceries, gas, kids' activities, home repairs, it all adds up. But waiting until something hurts often costs more in the long run. Preventative visits help us find problems early. A small cavity is usually easier to treat than a tooth with a deep infection. A cleaning is usually simpler than treating advanced gum disease. A minor crack may be easier to protect before the teeth break. The earlier we catch things, the more choices you usually have. Pain also has a way of showing up at the worst time. Teeth do not check your calendar. They do not say, I see you have a slow Tuesday coming up. I will hurt then. No, they often choose a Friday night, a holiday weekend, the day before vacation, or the morning you have 47 other things to do. Dental pain has terrible manners. Regular visits are like maintenance. You change the oil in your car before your engine quits. You clean the lint trap before the dryer overheats. You replace your smoke detector batteries before there's a fire. Dental checkups work the same way. The goal is to catch things before they become a crisis. Now let's answer the big question. Nothing hurts. How often should you see the dentist? For many people, a dental visit every 6 months is a good routine. But not everyone is the same. Some patients with gum disease, heavy tartar buildup, dry mouth, lots of cavities, diabetes, or other risk factors may need to be seen more often. Other patients may have a different schedule based on their needs. The right plan is personalized. This is why the phrase every 6 months is a helpful general rule, but it's not magic. Your mouth has its own story. We look at your gum health, cavity risk, bone levels, home care, medical history, and past dental problems. Then we recommend a schedule that makes sense. So what are the warning signs you should not ignore? Pain is one warning sign, of course, but do not wait for the pain. Call your dental team if you notice bleeding gums, swelling, bad breath that does not go away, a chipped tooth, a loose tooth, a tooth that feels high when you bite, sensitivity to cold or sweets, food packing between the teeth, a sore in your mouth that does not heal, or a filling or crown that feels different. Even small changes matter. A tiny chip can grow. A little sensitivity can be a clue. Bleeding gums can be a sign of inflammation. Your mouth gives hints before it yells. Here's another common one. It only hurts when I bite, then it goes away. That can be a sign of a crack or a bite issue. It may not hurt all day, but it's still worth checking. Teeth can be dramatic, but they're not always clear communicators. They're more like toddlers when something's wrong, but they can explain it well. Let's also talk about baby teeth and kids. For children, waiting until something hurts is especially risky. Kids may not explain dental pain clearly. A child may avoid chewing on one side, sleep poorly and cranky, or say something feels funny. Baby teeth matter because they help kids chew, speak, smile, and hold space for adult teeth. A small cavity in a child can grow quickly. Regular dental visits help children get comfortable, help parents learn what to watch for, and help us catch problems early. The same idea applies to adults. Teeth are easier to keep healthy than to replace. Dental bridges and dentures can be good options when teeth are missing, but keeping natural teeth healthy is usually the best plan when possible. So, if pain is not the best guide, what is it? The best guide is routine. Brush twice a day with fluoride toothpaste. Clean between your teeth twice a day. Limit frequent sugary snacks and drinks. Drink water. Wear a night guard if you grind, and if your dentist recommends one. Keep your regular dental visits based on your risk, and do not wait for pain to ask questions. A routine is not glamorous, but it works. Nobody makes a superhero movie about flossing. There's a dramatic music when somebody brushes for 2 minutes, but small daily habits protect your teeth in a big way. And if you're thinking, well, I have not been in for a while, now I feel awkward, please do not let that stop you. Dental teams see this all the time. You will not shock us. We are not going to faint because it's been a few years. We are here to help you figure out where things stand and what to do next. The first appointment back is usually just information. What looks healthy? What needs attention? What's urgent? What can wait? What options do we have now? The information gives you control. And that is really the heart of this episode. Seeing a dentist when something hurts is not wrong. If something hurts, please call. Pain should not be the only reason you come in. The best dental care is not just emergency care. It's prevention. It's early detection. It's helping with bigger problems. It's keeping small things small. So the next time someone says, I only go to the dentist when something hurts, you can tell them that is like just checking the engine oil after your vehicle starts smoking. Maybe say it kindly, unless it's your brother-in-law. Then use your own judgment. Your mouth can have problems before you feel pain. Regular dental visits can help catch those problems early. They can save time, money, stress, and teeth. This is Dr. Mason Haley with Wahpeton Family Dentistry. Thank you for listening. And remember, we're here to take the fear out of dentistry and help you make informed decisions about your oral health.